Bereavement support, honoring grief. Grief is a natural response to loss, characterized by intense emotional pain and distress. Bereavement is the state of being while mourning the loss of a loved one. Types of grief include acute grief, complicated grief, anticipatory grief, and collective grief. Individuals experience acute grief have an immediate response to the loss. Individuals experiencing complicated grief have a prolonged and intense grief. Individuals experiencing anticipatory grief experience grief before a loss occurs. Collective grief refers to a community sharing the grief experience. The stages of bereavement most commonly referred to are denial, anger, bargaining, depression, and acceptance. It is important to note that each grief journey is unique, and these are simply examples. Individuals experiencing bereavement symptoms may feel intense sadness, anxiety, guilt, and emotional pain. They may experience fatigue, changes in appetite, sleep disturbances, and have physical pain. They may have a difficulty concentrating, experiencing memory problems and/or confusion. They may have changes in their daily routines or withdraw socially. Bereavement support includes emotional support, practical support, and spiritual support. Offering emotional support includes listening, providing empathy and validation to help individuals process their emotions. Offering practical support includes supporting daily living activities, providing respite care, and access to resources that help individuals manage daily tasks. Providing spiritual support includes offering spiritual guidance and connection to help individuals find meaning and purpose. Bereavement risk factors include experiencing a traumatic, unexpected, or violent loss, loss of a spouse, child, or close family member or friend, cumulative grief from multiple losses, prior experience with trauma or loss, previous mental health conditions such as depression or anxiety, insufficient support from family, friends, or community, beliefs that impact grief expression, age, and vulnerability factors. Signs of complicated grief. Intense emotional pain, sadness, anger, or guilt. Preoccupation with the deceased, persistent memories, thoughts, or dreams. Avoiding people, places, or activities that remind them of the deceased. Ruminating about the loss or death. Difficulty experiencing emotions. Feeling disconnected from others. Using mind-altering substances to cope with grief. Assessment and intervention. Utilize standard screening tools to identify bereavement risk. Conduct a comprehensive assessment to identify individual risk factors. Provide early support and intervention to prevent complicated grief. Offer individual or group counseling to process grief and develop coping strategies. Connect individuals with support groups. Refer individuals to therapy or counseling if they are experiencing complicated grief. Common assessment tools include the Grief Assessment Scale, which evaluates grief intensity and symptoms. The Complicated Grief Inventory assesses complicated grief symptoms. Hospice Bereavement Support. Hospice care provides bereavement support to family caregivers and close friends of patients. These services are typically provided by the social worker or chaplain. The services continue for 13 months following the patient's death. Within 24 hours after the patient's death, a hospice team member will offer support, condolences, and provide information about the bereavement services. A hospice team member will contact the patient's loved one at least every 2 weeks for the first 6 weeks, at least every 4 weeks for the next 12 weeks, and at least every 8 weeks for the remaining 36 weeks. Bereavement support may include phone calls, in-person visits, written letters or mailings, support groups, or memorial services. Everyone grieves differently. The level of contact the patient's loved ones prefer will differ. It is up to the entire care team to be a grief guardian for those our patients leave behind.